We're Sencha Health. We are in the business of streamlining and automating processes, and we have even automated the production of new software. Usually, we talk about the state of healthcare and health insurance in the United States, and today is no different. Today, we are going to discuss the Lancet's article about healthcare in the United States, what is wrong with it, and how to fix it. I will be back to draw conclusions after our presentation.
Today, we are going to discuss what the Lancet thinks is wrong with healthcare in the United States, how this compares to other evaluations, its costs in both lives and dollars, and how to completely fix this system. The Lancet, a science-based journal in the UK, published an article on January 4, 2025, titled Whispers from the Imperial Capital that stated,
"The assassination of Brian Thompson, United Healthcare's chief executive officer, on December 4, 2024, in New York City, has catapulted American medicine, with all of its tragic inconsistencies and injustices, once again into the political spotlight, with the words deny, depose, and defend inscribed on 3 bullet casings. Attention was drawn to the questionable practices of America's health insurance companies. They faced allegations of delaying payments, denying settlements, and defending obstructive behaviors by tying patients up in expensive litigation. It was, and is, quite a charge sheet for U.S. President Donald Trump to address after his inauguration later this month. The murder of Thompson coincided with the launch in Washington, D.C., in collaboration with the Council on Foreign Relations, of the Lancet's presidential briefing book on the state of America's health. Led by the Institute for Health Metrics and Evaluation, new research described wide disparities in well-being across race and ethnicity, age, sex, and location. Extraordinary inequalities in life expectancy, a huge burden of diseases, injuries, and risk factors, worsening prevalence of overweight and obesity among children, young people, and adults, and the alarming trajectory of health challenges in the USA, based on forecasts to 2050. But these findings are surely far more than alarming. They demonstrate the utter failure of America's health system to reap benefits from the vast resources the country spends on healthcare and medical research.
Let's break this down and see what we need to solve these problems. Our analysis suggests that the Lancet identified 6 problems: delaying payments, denying settlements, delaying through litigation, wide disparities in well-being, inequalities in life expectancy, obesity. We find 2 different categories of problem here. First, delaying and denying payments. Second is chronic disease. Let's take a closer look at each. Denying and delaying payments are business tactics designed to increase profits for health insurance companies. By denying payments, the insurance company gets to simply keep premiums collected instead of paying them back as benefits. Delaying payments, either through denials or litigation, keeps the coffers full and earning interest for the company, much the same way Zelle or PayPal earn their profits. All of this is illegal and unethical, and is costing lives, that is, literally killing people. Treatment for chronic, behavior-based disease consumes 84%, or $3.7 trillion, of the $4.4 trillion spent on healthcare each year in the U.S. If we could get back even a portion of that $3.7 trillion, we could lower the overall cost of healthcare and save millions of lives. It seems that the problems identified by the Lancet distill down into 2 things: money and education. If we can pry this industry out of the greedy fingers of the finance people, we can reduce costs. If we can figure out a way to incentivize patients to live a healthier lifestyle, we can further reduce costs and save millions more lives. The solution is to put health insurance companies out of business. You don't want bankers running anything. They crash the economy every 10 years on average, and it doesn't have to be that way. Yes, bankers are running insurance companies. Just like the Lancet, the Commonwealth Fund identified several problems in their paper, U.S. Healthcare from a Global Perspective, 2022. Accelerating spending, worsening outcomes, that basically boiled down to the same 2 problems. Health insurance is too expensive, and patient education is largely ignored. These sound amazingly like the 2 categories from the Lancet: money and education. If we can address these 2 problems, we can fix the U.S. healthcare system. Health insurance companies have two inputs, a patient and a procedure, and one output, a check to the practice for the procedure performed. That is it. If we automate the process between the input and the output, then we have eliminated everything the insurance company does, except for transferring the money. The only other thing we need to add would be some way to educate and incentivize the patient on how to live a healthy lifestyle. That would result in fewer claims, causing reduced rates for everyone. We at Sencha have designed and developed a solution that completely automates health insurance. We provide the electronic medical records, EMR, system to the practice, and when they code a patient encounter, we pull out the procedures performed and pay for them in real time. There is no adjudication, no denials, no medical coding, no big buildings, no people, and most importantly, little to no cost once the system is built. For this service, we charge $10 per month plus the actual cost of the risk. Remember that your health insurance company only returns 53% of your premiums as benefits. We can return the 47% they waste, on average, to the patient, in lieu of the previously stated $10 per month. There are other efficiencies we will explain, and a way to manage chronic, behavior-based disease. Also remember that treatment for chronic, behavior-based disease consumes 84%, or $3.7 trillion, of the $4.4 trillion spent on healthcare each year in the U.S. The average of avoidable deaths per 100,000 in OECD countries is 225. In the U.S., it is 335, or about 33% higher. If we could bring the U.S. average down to the OECD average, we would save about $1.2 trillion. That is a further reduction in costs of about a quarter of the total. How do we do this? We offer financial incentives for people who live a healthier lifestyle as measured by our built-in health and wellness system. This system takes into account measurements taken at the primary care physician's practice, like height, weight, and blood pressure, plus things screened for in blood work. Additionally, there is a mental health screening right in the wellness package. This system looks at all these factors and then prescribes patient education based on the results. At Sencha, this is part of the system. We can tell when the patient opened the patient education and how long they spent reading it, and offer a small discount for simply doing so. A larger discount is offered for reading and following the education, as evidenced by better results in the patient screening. Let's look at big round numbers. Let's say we can save the patient about 40% on their health insurance up front. Let's say that we save the people of the U.S. another 25% by being educated about healthy living and getting to the average OECD deaths per 100,000. We know that eliminating medical coding, providing a free EMR to the practice, and putting compliance and efficacy reporting into that system will save each and every practitioner an additional $77,000 per year that they currently spend. That, however, is only about 2% of the total, so we'll just ignore it. If we total all that up, we see more than 60% savings. That means that we would not only have the best healthcare on the planet, but also the cheapest.
The way that health insurance is run is a complete scam. We have shown a way to save about 60% from the cost of health insurance and addressed both of the Lancet's two conclusions about health insurance in the US, cost and education. We have all of this written and deployed in a prototype application. The only thing we really need to get this all started is to clean up that application and turn it into an enterprise application with logging, administration, and redundancies in hardware. We will need funding, probably about $100 million over the first 2 years, like other startup health insurance companies. For comparison, United Healthcare had revenue of $371.6 billion and net earnings of $22.3 billion. With a total 60% savings, we should service and retain 90% or more of the 300 million insured people in the U.S. That gives us a revenue of $36 billion. However, everything in our system is automated, so that is a $32.4 billion profit at a 90% profit margin. If you want to be a part of saving healthcare and make a ton of money, here is your opportunity. We have shown a way to make patients healthier by educating them on the consequences of their behavior, and a way to capitalize on that to the sum of $1.2 trillion, or about 25%. If we add that to the process automation savings of our solution, we are in the ballpark of more than 60% savings in total. We already have the best doctors and the best equipment. We just need to implement the above detailed framework to give them all the tools necessary for success. We have this system in prototype now, fully functioning. Contact us here or on our site, and we will be happy to provide a demonstration of the fully functional prototype. If you liked what you heard, please like and subscribe, click on the notification icon, subscribe to our newsletter, and follow us on all our social media and blog sites. You can read the text version of this presentation at senchahealth.substack.com. We have built a comprehensive health information system to keep the patient healthy and on the right track with the ability to incentivize healthy living. Implementing this system should be fairly simple and will completely revolutionize the way healthcare is paid for, saving countless lives. We have shown a way to use this system to make the best healthcare system in the world, also the most efficacious and the most affordable, and a way to move toward value-based care.